Hi, it's Lee here from Shanggong Chinese Medicine Wellness Center. With this, you might be wondering, what are you going to be talking about? Today, I want to be sharing with you how Chinese medicine practitioners go through their assessment process. So obviously, if you think of the last time you went to see a mainstream doctor or Western medicine doctor, they probably would use one of those, a stethoscope, to listen to your heart, to listen to your lungs, to determine if everything is functioning well. That is how Western medicine go through assessment. So how do Chinese medicine doctors or practitioners do their assessment? Now, let me tell you this, it is very, very different. So in Chinese medicine, there are actually four main components of an assessment process. It is called Wang, Wen, Wen, Jie. Okay, let me go through each one of them. So Wang means look. They will look at your appearances, not to judge whether you have beautiful skin or whatever. That is one component though, because your skin actually is a representation of your overall wellness and your overall health, according to Chinese medicine, which makes sense. And also the color of your eyes, the color of your overall skin tone, and just your appearance. Are you appearing to be, in a very well looked, if that makes sense, appearances, or some people are hunched over, they're frowning all the time. All of those are actually, that matters for a Chinese medicine practitioner. And that's look. Wen means smell. Yes, your body odor, even your breath, the odor of your breath, odor of your body tells different stories in Chinese medicine assessment process. So that is something. It doesn't mean, you are coming in, you want to spray a whole bunch of cologne or perfume. Don't do that, because what we want to do assessment for is to really determine what they can do to support your health and well-being, to enhance it, to make it better, so you feel your best in your own body, in your own health. And the second is smell. Wen means ask. So they ask a lot of questions. By the end of it, you feel like, this person really knows me well. And that is one part of Chinese medicine assessment process. So I have a form of what we use here at Shanggong Chinese Medicine Wellness Center. Again, you don't need to know the details. It's quite a few pages. This is 1, 2, 3, 4, 5. We have 5 pages of all our questionnaires, and this is part of our assessment process. Again, starting from very basic fundamental ones. Do you smoke? Do you drinking alcohol? Do you drink any caffeinated beverages, such as even Coke, things like that? Are you taking any medication? Are you taking any supplements? And do you have any allergies? Some basic stuff. And then we get into all of your histories of any of diagnosis or symptoms you're experiencing. If you have a past diagnosis image taking, such as X-ray or ECG, to measure your heart function, and any blood tests that are abnormal. Again, even though they are Western medicine based diagnose tools, Chinese medicine practitioners still would want to know all of that. Also, we want to know your family history, your parents, your grandparents from both sides, your siblings, if they have any major chronic conditions that may or may not affect you, and your past history of surgery, of any car collision, that kind of all of that information. So it is a very, very thorough questionnaire, and they will ask a lot of other things for including your appetite, including your mood, including your bowel movement, including the sensation of are you thirsty on a regular basis, because all of those really plays a role in this entire assessment process. For women, of course, your menstrual cycle, if you're still experiencing one, how many children you've had, and all of that are part of the process. So that is the third part, which is ask. And the last part is 切. 切 means to read your pulse. So, and if you ever notice, they actually use 3 fingers, and on one hand, they will do a, each finger will tell them a different story. Again, don't ask me, I'm not a Chinese medicine practitioner, so I don't know the details. And this is basically how, and when you are seeing a Chinese medicine doctor or practitioner, then you can totally ask them exactly which part are they reading, what is the story is telling them. And also they do both hands. It's not just one hand, one wrist versus another, they do both. And again, 3 fingers, and that is 切, which is reading your pulse. So that is how Chinese medicine doctors and practitioners do their assessment. From all of the information they gather, they will have a conclusion of what they can do to best support you, what treatment they can recommend, what plan they can come out with to support and enhance your health and well-being. Now, this is the content of this video. See you next time.